Hello, everyone. So today we are going to talk about resume and CV in your path from BDS to DMD. My name is Dr. Jasmine and welcome again. Hope you all are well. Hope you all are safe. Hope you all are healthy and hope you all are still very excited on your journey from BDS to DMD. So as promised, our today's video is going to be on resume versus CV. What is an SOP? What is a professional statement? What are the things that you can include in them? What are the things that you should be aware of? What are the do's and what are the don'ts? One of the reasons I am so passionate about this particular video is, as I mentioned to you in my last video, that I work as a director of talent and I'm the head of recruitment for a big practice in the New England states, and I recruit for almost 78 to 80 practices, and I have a team of recruiters that report directly to me, and therefore I get a chance to see so many resumes and CVs, and I felt so passionate about it that I spoke at a few conferences and I addressed a class of dental hygiene students, the DMD students, um, and walk them through the process of the resume and the CV and the do's and the don'ts. So let's get started. So most important, what is the difference between a resume and a CV? So resume, it's usually one page. Resume is made to get a job. CV has details, mostly academic. So CV is for academics and resume is to get a job. So what is a resume? Resume is it's an introduction of you. So let's say you are in, an elevator and you are with the CEO of a company where you're looking for a job. And your 30-second elevator speech is going to be the summary of your resume, which says, this is who I am, this is what I do, these are my strengths, and this is what I can bring to the table. So it's basically an introduction to you. It highlights more about your professional skills, your qualifications, and you just write about your degree. So you don't go in detail about academic accomplishments and in a resume. So it starts with a summary followed by work experience, skills, and then an education and degree. If you are an existing dentist in US, or if you are anybody in any profession, and if you need me to go through your resume or CV and take a look at it and give you a little bit of advice and help that I can, I will be more than happy. Please feel free to drop me a message on the channel and I'll be more than happy to send you my personal email address and I'll review it for you. That's a very small thing that I can do. I would love to. So what is a CV? So CV has credentials, which is academics, research, it's more detailed. So CV is usually 2 to 3 pages. If you are someone who has an 8-page CV, I would suggest trying to condense it, and then you can add, how there is in the application section, it says on CAAPID, it says, do you have any supplemental documents? You can always add a list of publications, because I know some of you may be extremely talented, may have been in the field of research for a really long time. And I personally know someone, well, he's not in the dental field, but who is a chemical engineer, and he has 200 publications in US. And I do know that there may be people, who are that talented and hardworking. So please make sure that you restrict your CV to 2 to 3 pages, especially for CAAPID application. It should have a summary of your academics, your experiences, publications, your research work, academic awards, any other awards, your degrees, your volunteer experience, your other achievements. And you usually start a CV with an education. So like what your degrees, what your qualifications are. On a resume, you usually have the education point, right on the bottom part of it. And on the top, you have work experience. So how to create a CV? I'm going to break it down into 6 different sections. This again is only for CAAPID purposes. This again is for the ADIA Pass or ADIA CAAPID. So how to create a CV. So we'll walk through what is the purpose, what should be its contents, how to format it, what makes your CV unique. This is the most important thing. Of course, what not to include, and I'll tell you what to include as well, and what is the difference between a resume and CV, which we've already spoken about. So what is the purpose of a CV? What do we all want when we apply to CAAPID website is get an interview. And that is the purpose of your CV. So the moment someone takes a look at it, apart from the other things that are there on your credential, but a CV has to be, so a CV and a statement of purpose, or these are two, or a professional statement. These are two documents which basically are something that you use as a marketing tool where you cannot be physically present. So it's a detailed description of all your achievements, and the goal is to get an interview. What are its contents? And we'll go very slowly over this slide. We'll spend good minute and a half or so you can see what are its contents. Your name, your email address, a phone number, and a physical address. It's absolutely okay, because we are applying to an international program, not to have a complete address. You could just write Mumbai, Maharashtra, India, or you could write Jalandhar, Punjab, India, so Ahmedabad, Gujarat, India. You don't have to write the complete address. A phone number, yes, of course it will be, and I'm only talking from the Indian students' perspective. So it may be like a +91 and then your phone number, and but do put a phone number, please. The next thing would be summary and objective. Keep this to 2 or 3 sentences, crisp, short, and to the point. So what does your summary should say? An internationally trained dentist who is, this is just an example, you don't have to write exactly, but you could say an internationally trained dentist specializing in patient education and motivation, who is looking to get in an advanced standing program to learn more technology skills like CAD, CAM, CEREC. This is just an example. Or you could say an international trained dentist with expertise in orthodontics and management experience working for a big hospital, looking to advance skills and learn from an esteemed dental school as yours. So something like that, but make it unique, make it short, make it crisp, not more than 2 or 3 lines. Then the next one is education. And I say in reverse chronological order is, so let's say MDS and then BDS. And in between, if you've done any master's or an MBA, then you could add that, but always reverse. So the newest degree first and the oldest degree at the bottom. Academic history. In academic history, what I mean is, if you are an academician, if you are an assistant professor or an associate professor or a visiting faculty, or someone who is working part-time in a school, that is something that you need to add in the academic history. Professional work experience, so the current one first. So let's say you're also a professor in a school, so in US, dental college is called a school. So if I say school, please take it as college. I'll try to say dental college, but so if you are a professor in a dental college, you'll write professor oral surgery, and assistant professor oral surgery. So that will be your first academic history. And then in the professional work experience, then you'll write whatever you're doing. If you have your own dental clinic and you're working there full time, or you are visiting at 6 different practices, so you could say as a specialist, so you could say visiting endodontist in Bombay, or in Delhi or Calcutta. And then, but always make sure that your current one is first and the oldest one is at the bottom. So when you write professional work experience, you definitely can write about internship also. So if, let's say, you are a fresh graduate, you could say, I'm working as an associate dentist currently at this particular location, and then below it you can say mandatory internship program, and then you could say that it was a rotation program in the following departments, and make sure that you write internship also. Then when you write about awards and honor, make sure you write in detail. So for example, let's say you received an award for the best clinician when you were in school. So write the best clinician award and then write the year. Or you received an award from a magazine or on IDA for that matter, Indian Dental Association, you should write award for outstanding community work, Indian Dental Association, and write the year there. But please make sure when you write awards and honors, please put details, and don't use abbreviations and short forms, because for you, IDA may be something that please don't expect everyone internationally to know. I mean, of course, we all know Indian Dental Association, but maybe, the moment because remember, in international standing class and advanced standing program, there are people from 100+ different countries that are applying. And the person who's looking at your application, they are professors who grew up here. So although they may know, it may not immediately, come through their mind that, oh, IDA is Indian Dental Association. So please, please, please make sure that you write the full form. Publications, presentations, make sure you write it with full citations. So what do I mean by that? Let's say, for example, I had a presentation where I wrote mylohyoid intubation, Journal of Oral and Maxillofacial Surgery, and then year was, I want to say, early 2000. So make sure you write that. If you are not the first author, then make sure that you write the name of the first author also, because remember, honesty is the best policy. You have to be honest. Professional affiliations. So for me, for example, it would be that I am on the alumni board of Boston University. I'm also the president of a district of Massachusetts Dental Society. I'm actually the chair of a district society. I'm also on the advisory boards of a few dental hygiene schools. So for me, that would be my professional affiliations. And for you, your professional affiliation could be that you are a member of Indian Dental Association, you're a member of your local dental association chapter, you could be a member of something which has nothing to do even with dentistry. You could be a member of maybe Rotary Club, or that does community work. But make sure if you're putting that you're a member of this particular community, or when I say community, I don't mean like an organization. That's what I mean by community, is if you are a member of any professional affiliation, whether it's the Endodontic Association, Aesthetic Association, dental, non-dental, medical, make sure you write the details. Please write the details. Grants and scholarships. Now, this is very important. Let's say you're a professor, or you are someone who does a lot of public health dentistry in India, and you got a grant. For example, there are people that I know from school who work with the Baba Amte mission, where they'll go and they'll serve the community which has patients who were abandoned by their family because of a particular disease they had. And there are people who are going to interior remote areas, or there are people who are working with, I want to say, women in rural areas, or, places where there are not even healthcare centers. So, and they have grants, whether it's a federal grant, by that I mean whether there's a government grant or there is a private grant. So private grants will be grant from Tata, Tata Corporation or the Reliance Corporation. And people do get these grants, and then they work on those grants to make change in people's life. So make sure you write those grants and scholarships, because once you get grants and scholarship from whether it's a profit or non-profit organization, it shows your credibility, which means people trust that the research that you are doing, they trust their money with you. And they know that the research that you're working on is something that's going to benefit someone. So it shows commitment. Then you write licenses and certification. This could be anything from Invisalign certified, Botox certified, CAD/CAM. If you've done courses on if you are a cleft and palate specialist or um, clear aligners, anything that you can think of in licenses and certification, please add that. And the most important thing, which we often neglect, is the volunteer work. With volunteer work, although I had mentioned in my last video that make sure you document everything, but please make sure that your CV stays to like 2 to 3 pages. Try to keep it under 3 pages. And if you have anything additional, you can always add it in the additional document section, or you can send it directly to the school. But I feel when you write about volunteer work, the same thing, make it, write detail. So, the more details you put, the better it is. Okay, formatting. How should it be formatted? 2 to 3 pages. My favorite font, Times New Roman, because it's a very clear font, very universal font. 11 to 12 font size. When I say A4, is that, because most things get printed on an A4 paper. So on the left side on the Word document where it says margins, instead of making it narrow, please keep it normal. Make sure there are two, it's better to write bullet points than to write big paragraphs. Because think of it, if there are 4,000 applicants that the school has, and then they have to narrow them down to bring 200 people for interview, would they be reading paragraphs? As I said, I'm not on a school committee that makes this decision, so I really don't know how the process works. But just being a recruiter, I can say that most recruiters will not have that much time. I mean, think of you, if you are in their shoes, would you have time to read paragraphs, or would you rather have bullets which are crisp and clear? And then please make sure you always check spelling and check grammar, because grammatical errors are the last thing that you want to see on a CV. And it has nothing to do, we all know English is our second language, and we should be very proud that we know our mother tongue and we also know other language. But you also have to understand that if you are looking to invest so much money and time, we should be well prepared. And the other thing with resumes and CVs having grammatical and spelling errors is when I read it, I feel, oh, this person is not committed, because you're marketing yourself, right, with that piece of paper. So automatically the person who's reading it feels that, oh, this person hasn't even taken effort in marketing themselves. I don't know how they're going to treat their patients. I mean, think of it this way, right? Whether we like it or not, they say don't judge a book by its cover, and we don't. But if you see, that the book has grammatical errors, will you buy it? Will you want your child to read it? And the answer is no, right? So the other thing is, this is a very nice joke I saw on this website. It's called justjobs.com. And it says, uh, fine, but our applicant tracking system isn't going to handle Roman numericals. So please make sure that that's why I said use Times New Roman font, a font size of 11 or 12, put bullet points. If you have to use numbers, please use regular numerical numbers, not Roman values, because sometimes the new applicant tracking systems that are being made, they actually don't recognize Roman numerals. And then sometimes things, instead of falling in that particular bracket, they just go and get pasted somewhere else. So keep it simple, keep it plain. So what makes your CV unique? I think you and your unique experiences and perspective will make a CV unique. And everyone, the universe has given you a unique strength. You have that one special thing which nobody else has. For example, let's say you are someone who has excellent chairside manners, who can talk to a patient, who can, calm them down. And, although clinically you may still be learning, but as an intern or as a D4 student, you're that one person where patient says, oh, where is that doctor that I saw last time? And I think that is your unique skill. So, that is something that makes you unique. There may be one person who's written 25 papers, and that's their unique skill because, maybe that's their research, those are their publications. But happy patients may be your unique skill. Or let's say you have a dental degree and an MBA, that's your unique skill. Or maybe you are a certified yoga instructor and you use uh, meditation as a way of calming down your patients, and that is your unique skill. So find that unique skill and um, talk to your friends, you know talk to your mom, talk to your dad, talk to your siblings. They are the best person who can tell you what unique skill that you have. So what not to include? This is very, 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 very important. Your personal detail, like complete address. Don't put it on a CV. You're anyway putting it on the CAAPID application. The reason I said don't put it on a CV is because, um, where I grew up, the address will take up an entire line. It's not short and crisp like the newer addresses. If you are in United States and you have a social security number, please do not put it on an application. Do not put your date of birth. One of the things, these things you do not put on your CV in the United States is because these are your unique identifiers. Just like your DentPin and CAPID number, this is unique just to you, and it is tagged to your personal number. And as a part of cybersecurity, it is advised not to put these things on your resume. Please do not put a photograph of you on your CV. I mean, there's no rule which says to put or not to, but I usually, all the books that I have read, they said don't put photos on CV unless you're looking for a job in a profession which does need your own portfolio. Um, Please don't put salary history. You are coming here to study. References, there's a separate section for it. You don't have to add references to your CV. You don't have to write any reason for leaving previous job. And please, even if in any interview, not just for school interviews, but if in any interview people ask you for a reason why you left the job, please try and stay positive. You may have other reasons for leaving the job, but um, it's usually a good idea to uh, leave the past right there and move on. And I feel that's something we all should stay with. Uh, Professional statement and statement of purpose. Now, how to write this one? So, I have a very creative husband, and I can tell you that for the statement of purpose, I wrote it down, and first I really could not think of how am I going to write statement of purpose, and this is something um, that he told me, and I'm going to share it with you. He said, well, start with a pen and paper. So that's exactly what I'm going to tell you. Well, start with a pen and paper. What I mean by that is sit with a pen and paper and think of these 4 or 5 questions. And if you want, please write them down. Why did you choose dentistry? What excites you about dentistry? Why would you want to do a DMD program? Um, what is it that gives you pleasure in being in a healthcare field? And what is it that you are changing or you are doing to grow? So, and I'll break it down and I'll tell you what I mean. So, what excites you about dentistry? So, it could be anything because it's your story. So become a storyteller. Uh, why do we like some movies and we don't like the others? Have you thought of it? Or when you look at one good thing, which, and this is again something my husband told me, he's like, why don't you look at National Geographic channel and see how they tell a story? And I actually started watching those documentaries and I realized, yes, storytelling is an art. So, they start with um, they don't directly jump to a story that they're talking about lions or tigers, they'll slowly say, okay, this is the universe, this is the earth. And then, so they they generate curiosity and interest. And that's exactly what your SOP should be. See, your CV is something where you've been direct, right? This is who I am, this is what I do, these are my educational qualifications, boom, 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 boom. But your personal statement, um, you should be a story writer. It should excite people. It should keep them involved. It's like reading Harry Potter. I mean, that's something I did read a lot of years ago. But it you did want to see, okay, what's on the next page? What's on the next page? And it will take time. I still am learning how to write, and it sometimes I have like 10 drafts, and then I'm like, oh, I don't like all of them. So what I do, I leave all those 10 drafts, I put them on the side, and then I take a break for a day or two, and then I come back, and boom, I have this new idea. And this is something, it comes to my mind, especially when I'm writing job descriptions, when I'm looking for dental directors. So that is exactly what you should do in a statement of purpose. So you should be, let's say, what excites you about dentistry or why you became a dentist. It could be something as simple as your father is a dentist, your mother is a dentist, or your sister is a dentist. Um, with me, I know one of my cousins is actually a veterinarian, and she one day called me and she's like, oh, do you want to, she's like, oh, you're going to be a dentist soon. She's like, why don't you come and see someone who really needs help? And I didn't know until I went there that it was a tiger. So that was my story. But your story is unique to yourself. Let's say as a child um, you had crowding in your teeth, and you saw your orthodontist, and your orthodontist fixed your teeth, gave you a great smile, and that helped you in boosting your morale and self-esteem. That could be your unique story. Or you knew someone who was in a trauma, or and then went to the dentist or the oral surgeon, and they did an amazing job, and this person looks fabulous. So, and that's why you decided, okay, this is something I want to do one day. So every story is unique. Or it could be that as a child you went to a dentist, and you really liked going to the dentist because every time he took your teeth out, your parents took you to eat ice cream, and they fed you so much ice cream that you're like, okay, yes, it hurts a little bit, but at the end you get so much ice cream. So make sure that when you write your professional statement, you want to connect with the reader on a human level. Not It cannot be about academics or just dentistry or stuff. You have to connect with the person who's reading it, as if you and I are talking. Always write statement of purpose as if you and I are talking. So, like something that I got interested in dentistry because as a child I would go to the dentist, and, whenever I got my baby teeth pulled, the dentist would give me a pop, and my parents would take me out to eat lots of ice cream for the next 2 3 days. And, I thought, okay, one day I want to become like him. And then the next paragraph could be that what do you then suddenly started liking and loving about dentistry once you got into dental school? So it could be things like you love serving your patients, because that's something I thoroughly do. I dearly, honestly love treating my patients. And I feel if that's something that you like, then you should write that. I love educating and motivating my patients. I till date love talking to uh, mothers, because usually when women are pregnant, they they try their level best to take care of their teeth. But as working women, we all are very busy, and that's something I feel is my responsibility, to talk to them about their oral health and how a bad oral health may affect their child. So once you have these points, and then the last concluding paragraph could be that what value will you be adding to the school if you get admitted, you know grad once you get admission to the school. You could add any value. For example, it could be that you're someone who knows management, and you would like to share your experience with your class and learn from people who are so strong clinically, because you don't have a chance to practice for 20 years like them, and learn from them. And you want to learn from the school. And then what really excites you about DMD? What is your reason for pursuing a DMD? It could be anything. Maybe you come from a country where you feel that your children can get better education in the United States, or you feel your family can have a better life, or you feel you as an individual can grow. And, just make sure that it is unique to you. And I think that's the most important point. What motivates you? Now, this is going to help you in writing your personal statement. Is it the rewards, the goal, the supportive peers, whether it's a friendly work environment, a professional satisfaction, whether it's a challenge that we as dentists have every day? No two teeth are same, and no two people are same, and every person has at least 28 teeth if they don't have wisdom teeth. And then, what is your encouragement? Use these pointers to write your statement of purpose. And believe me, you'll do an excellent job. I trust you. I trust you 100% to do a good job. That brings me to the conclusion of this video. I haven't thought of my next topic yet, but what I'm thinking, the next slide could be about different dental schools and what their unique features are. But if you have any questions, and if you would want me to prepare any video on particular topics, please let me know. Take care, good luck, stay safe, and stay healthy.